This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Mike Sedita.
Hello out there. Welcome to episode 109 of the Good Neighbor Podcast. I'm your host, Mike Sedita, and I am joined today. This is one of my favorite types of interviews to do. I have Dr. Linda Register. She is the owner, head doctor in charge at East West Animal Hospital. How are you doing today, Linda?
Pretty good. Not too crazy of a day today, which is always good.
That is good. You have time to sit down with us and do a podcast and tell us a little bit about your business. We, just so you know, a little understanding, I know this is old hat to you. You are a veteran of interviews on the radio and things like that. But what the Good Neighbor Podcast is and how we got started back in 2020, when everybody was socially distant, when you were meeting patients in the parking lot and taking dogs in, the Good Neighbor Podcast got started as a way for businesses in the community to let people know where they were, what they were doing, and how to connect with them. And over the last 3 years, we've evolved into a national brand. So we have podcasts in Denver, Colorado, Atlanta, Georgia, Virginia, all over the United States. I'm fortunate enough to be the person here in Tampa that gets to talk to business owners and entrepreneurs and animal people like you. So tell us a little bit about East West Animal Hospital.
Well, in short, we are a privately owned practice, fear-free certified, that offers integrative medicine to small animals and in general medicine, general practice. So what that means is, one, I'm not owned by a corporation. I'm the one that owns the practice. Two, being fear-free certified, it means that our goal is to eliminate or minimize the stress of our patients when they come in to the veterinarian, because a lot of clients won't take their pets in to get checked out if they're stressed every time they go to the vet. And then the integrative medicine, I do Western medicine, but I also try and integrate holistic medicine as well, which my specialty is Chinese medicine, which is acupuncture, herbs, and food therapy. And then I do general practice stuff. So I see puppies all the way through end of life.
Okay, so I have a couple of questions. Okay, so you sort of answered one there. You initially said small animals. So everything from my hamster up to if I have a grizzly bear or whatever, it doesn't matter the size.
Generally dogs and cats. I do some pocket pets.
Okay, and then like
hamsters, rabbits, and things like that.
And like, you're not like Dr. Poole, like you're not gonna wrestle an alligator or like like horses. Like, I mean, there is still some in this area. That's not your specialty. It's family pets, cats and dogs mostly. Correct.
My body can't handle the large animals anymore.
Okay, so the next question I have is, and this is a personal one from that, is what about short brachialis dogs like Norman here in our video?
I see a lot of English Bulldogs and French Bulldogs.
Well, French Bulldogs are the number one breed now. They think they're all high and mighty. They're all important. But those short-nosed dogs, the boxers, the Bulldogs, the pugs,
I see all those
guys.
And I've even had people call and ask if I see big dogs. My biggest dog right now is an Irish Wolfhound, and I want to say she's like 160 pounds.
Oof. A friend of mine has a Napoleon Mastiff. I don't know if I'm Holy cow. This thing is, I mean, its head is massive. It would fill up this whole box on the podcast. He's huge. But the next question I have for you, and this is kind of a business side of one, is because you answered the fear-free stuff, which is important, but small corporations. So what I'm noticing as someone who deals with business owners, and this is happening in a lot of different verticals, but it's happening in the real estate market where big businesses are buying up all this real estate where they can kind of control the market. It's definitely happening in dental practices. I'm watching it happen in dental practices. But are you saying also in the veterinarian vertical, there's a lot of big, like I know, like, and I don't want to get too specific in names, but one of the big pet candy companies that's out there, they have a whole pet division that they're buying up a lot of small practices. Are you fighting up against that quite a bit?
Yes. There's a lot of practices that are corporate owned. And part of the reason is single practitioners especially are having a hard time finding younger graduates that are willing to buy a practice. So in order to get the most bang for their buck, so to speak, they end up selling to corporations, which, I mean, there's pros and cons to it. From my standpoint, I think in the end, it's going to be, I think the downfall. I think corporate practices have their place, but I don't think it's for every practice. A lot of these practices, you don't get to know the clients, the patients. Clients don't always see the same doctor twice.
Yeah.
In a year time, your pet could go in multiple times and you see a different doctor each time, which if you have a patient with chronic issues isn't necessarily a good thing, because if they have chronic issues, you want to deal with someone who knows
continuity
and knows the issues and knows how to deal with them and know what medications they're on and things like that.
Well, that is kind of right. Like you said, pros and cons. So from the outside looking in, as someone just hosting a dumb podcast, there's probably systems in place, right? Like there's systems in place that are efficient when you're at that level, but
right.
The continuity of care and that one-to-one approach gets lost in a lot of this corporate takeover of stuff, right? So
correct.
For me, I mean, I've had bulldogs. It's now 20 years. I got my first bulldog on Christmas Day of 2003. So I lived in Atlanta, and we went to this rinky dink. Like, if you looked at it from the outside, you would say, who the heck is going to bring their animal to this place? It was side of the road, little ranch house with a basement kennel. Like, you would not go, oh my God, it was plush and beautiful. And I had come from the plush and beautiful, everything was fixed up. The vet, just, again, not to knock anybody or not give names, but just the continuity of care wasn't there. My dog got passed off to a newer vet, didn't know what she was necessarily looking at, scared the hell out of my ex-wife and I, and told us our dog was dying and was riddled with cancer and was just reading film wrong.
Mm-hmm.
And freaked us out. So we said, well, we got to find this other vet. We find this other vet. And when I tell you, I am still friends with my vet, and I became so close. She spent holidays at our house. Now, granted, we had 4 English Bulldogs. I think we put 2 of the vet's kids through college with the 4 English Bulldogs. But our vet, Heather Wood, she went to the University of Florida. She was our vet for years and years and years. When we moved to Florida, it was that was one of the hardest things, to go from having that caring continuity of care, where now it's kind of, you got to find somebody over again and start over again and kind of figure it out. And unfortunately, I've gone through a couple different people trying to find somebody, because there is, having a bulldog, there is those questions. That's why it's literally the first question I ask. Some vets just aren't familiar with the breed enough, because they didn't, when I first got a bulldog in 2003, they weren't as prevalent as they are now. So now people are getting more familiar, but in the beginning, it was hard. Tell me a little bit about your background. Have you always been an animal lover? Like, when you were a little girl, did you just want to be a vet, or were you going to go to be like a surgeon on Grey's Anatomy and change your mind and decided to become a vet?
It's always been with animals. My family, lived in somewhat of a rural area. You only took pets into the vet when they were injured or for their rabies shot. Heartworm prevention wasn't available early on until, after I got into the field, or shortly after before I got into the field. And so, we just always, tried to treat and doctor things up. And so it just kind of evolved from there.
So were you the person that, like, you would find an animal and bring them into the house and say, hey, we have to nurse this animal back to health?
Not so much me, but my mom and my grandmother did quite a bit of that. So that could be where
that's where you got it. That's where you got it. So let me ask you this. One of the questions I like to ask is, because it gives people a little bit of insight into like being a business owner. We kind of talked about the different levels of business that's going on here with veterinarians and takeovers and corporate and that stuff. What is a big misconception or myth that you run into? Like, patients come in and they think that you're able to do something and you're just not able to do? Like, what is something you have to really educate people on?
Part of it, one of the things is the importance of heartworm prevention, because I have a lot of holistic clients. They don't want their pets on heartworm prevention.
Right.
They want natural products. All of my mentors in Chinese medicine, when it comes to parasites, recommend conventional medicine. We don't vaccinate for everything. I have a modified vaccine protocol that I use that has been evaluated by Dr. Richard Ford, who is an immunologist at University of North Carolina. And so I don't give more than one injectable vaccine at a time in case there is a reaction.
Okay.
And then once the pet's old enough, generally 4 years old or so, based on our vaccine protocols, for at least distemper and parvo, we will do vaccine titers. And that's where we analyze the blood sample to see if they have enough antibodies to see if they even need the vaccine. I don't vaccinate for everything. And if I do, it's for patients who really need it, who are at risk. And some of them are like show dogs or search and rescue dogs.
Right.
Some of the other misconceptions is services are free. Unfortunately, people want higher quality care. They want the technology. And unfortunately, with that, it comes at a price.
Wait, time out. I don't mean to interrupt you, but people think that veterinarian services are free?
Free or low cost. Should be low cost. Yes. Believe it or not, people think that.
Yeah, I own bulldogs, so if I leave the vet with less than $300, I'm like, wow, this is a great visit. I love this visit. Okay, so that actually blows me away that people would think that. I kind of think it's the opposite. I think people realize this is your loved one that you take care of, just like you take care of a child. Having a pet is a lifetime. At least that's the way I was. Yeah. Oh, that's my right. So like, I'm going to do whatever I can to so I don't have that, but okay. That was a misconception you run into. So how do you drop the hammer on people? I mean, you give, when someone comes in, I know they do this at some of the vets I've gone to, is they'll say, here's an estimate of services. You show them that, and then they go, oh, I thought it was free. I thought it was going to be free, and they have to educate them.
Well, I mean, sometimes they think certain things are free. Sometimes they're surprised at the cost because, everything has gone up. We do a treatment plan. We look at the patient and come up with a game plan as far as what we feel is going to be the best for the patient. And unfortunately, sometimes, especially if the pet is sick, it is sometimes out of the budget for people. And so we try and work with them the best we can as far as what's going to be most important. What's going to give us the most information based on what's going on. Unfortunately, when it comes to medicine in general, whether it's people or animals, it's not always an exact science. Well,
yeah, of course. I mean, you're even saying that about vaccines, right? Like, if I throw 3 different vaccines in a needle and drop it into my dog, you're even taking the precaution. It's not an exact science. They could be allergic to one or the other. Like, you just don't know. I mean, and my poor dog, this little fat white bulldog, he's allergic to grass. Like, he right now I'm going through a thing with his paws. He's got to have the cone of shame on him.
Most bulldogs are allergic to life, in my opinion.
Yeah, right. Well, so it's funny you say that. So he's white. So like, if he's outside with me in the summertime, like, I want to put I want to coat him in suntan lotion. His skin is so fair. There's that. What's funny is, and I'm going to sound like a jerk when I say this, which isn't unusual. It happens from time to time, but people will see me with a bulldog. This is going back 20 years, and they'll say, oh my God, he's so cute. I want to get one. I've always wanted to get one, but they're so expensive to buy. And I would say to them, listen, I'm going to be completely honest with you. If you cannot afford to buy a bulldog, I promise you cannot afford to own a bulldog. And if you're not ready to invest, then you know what? This is not the dog for you. So exactly what you're talking about. I have pet insurance. I pay more for pet insurance on Norman than I pay for my own health care. Mm-hmm. And the only reason I do it, Linda, is because in 2020, and I made the reference in the beginning of the podcast about meeting patients at the car. Norman was having an issue breathing. I took him to the vet. I had to take him to Blue Pearl because it was an emergent thing. They met me outside. We went through the evaluation. We did the whole thing. And I said, okay, can I say goodbye to him? I'm leaving. I had to get clearance. They wouldn't let my ex-wife in. It was only me to go and say goodbye to him. And I'm air quoting here because they didn't think he was going to make it.
Yep.
The bill for that damn hyperbaric chamber over a 7-day period was $13,000. Thank God I had the insurance because I got reimbursed for a huge percentage of that. But again, I don't want to be in that situation. I'd rather pay the money up front to know that I'm going to get a bunch of coverage on him so that I don't have to go, oh my God, I can't afford to get my dog healthy. That would be the killer for me.
Well, one of the things that we do offer that helps clients provide optimal care for their pets without the financial constraints of paying a huge amount of money each time is we offer preventative care plans. And our preventative care plans are designed for the way that I practice medicine. We offer puppy and kitten plans. We have 2 of them. We have one that includes spay and neutering and one that doesn't. Because if you get a pet from a rescue group or from the shelter, they're often spayed and neutered. And then we also have 3 levels for adult plans based on the pet's age and needs, ranging from a core plan that is just, basic wellness stuff, blood work, vaccines. Our middle plan called a Core Plus includes basic vaccines, blood work, as well as a grade 1 dental. And then our senior plan includes all that, plus blood pressures, x-rays, 3-view chest x-rays, and all of the adult plans include vaccine titers if the patient is at a state in their life where they're due for a booster and we feel that, maybe they don't need the booster because they've been vaccinated multiple times in their lifetime.
So it's almost like prepackaged preventative care. Like you kind of prepackaged going in.
That's exactly what it is. And the prices are different based on what level you get.
Right.
The prices are going to change after the first of the year because the price of everything has changed. Unfortunately, in the past year. But the advantage is, what you're going to pay every month for the basic care. And anything on the outside, such as your dog, for example, prone to ear and skin stuff. Say you have a plan for your pet and he comes in with a skin flare up. You pay a lesser copay for the exam and you get 10% off diagnostics and medications that are purchased and dispensed in office. So you get an added benefit by having the plan. So
you talked about the different types of vaccines, and listen, we're probably going to go long because I have so many questions. So
that's fine.
So here's one of the things that I always did, and it could be wrong. I'm coming to the expert to ask this question. My dog, I don't ever go to dog parks anymore. I don't do that. I've had too many instances where pet owners think the dog park is like a daycare that they could let their animal just run roughshod over everybody. So I don't do the dog park thing anymore. So I have chosen for a long time not to get my dogs the Bordetella shot because they're not drinking out of water or shared water bowls. They're not around other animals ever, other than my pack when I had 4 of them. That was those 4. I mean, would that be kind of under where you do that blood work to say, hey, look, he might not need this? Is that kind of what?
Unfortunately not, because the Bordetella, the way the disease works, it's an upper respiratory infection. So you need to have local immunity with the mucous membranes.
Okay.
That is not something that works systemically. Now, for Bordetella, there are injectable vaccines, intranasal vaccines, and oral vaccines.
Okay.
The vaccine that we give is oral.
Okay.
One, because in general, it's a lot easier. Because we're fear-free, we can cover the tip of the dispenser with peanut butter or cheese or something that the pet likes and licks it. When it comes to upper respiratory infections can be airborne. And I have seen patients in certain neighborhoods, say someone had a dog that was boarded and they come home and they've got the upper respiratory infection and they're coughing. And then, you start seeing a bunch of dogs, and if you map it out, they're all around the same neighborhood where this dog was.
All right, so Bordetella is definitely one that they should be getting all the time.
Well, it's not considered a core vaccine, but certainly we stress it if they go to boarding, grooming, dog parks, walking around the neighborhood, doggy daycare, training, things of the like.
Norman just sits and records podcasts with me, but it's so funny. I'm so dumb. I do word association. So I think boarding and Bordetella, that's kind of where I put the two and two together.
Yeah.
And then the other one, I'll tell you a horrible story. The last dog I had before I had Bulldogs was a German Shepherd. Sweetest dog on the planet, super smart. I mean, Bulldogs are smart. They're stubborn. They go to their own beat. But German Shepherd, I could talk to her like you and I are having a conversation. I could describe a toy. She would know what toy it was and go get it. So she wasn't properly vaccinated for distemper. And the vet had a long story as to why, but I had a fatal attraction thing going on. But I had to change my phone number, and the vet didn't have the right phone number, couldn't get a hold of me. And the dog went from 110-pound German Shepherd to like 70 pounds in a 2-week period. I went back and forth to the vet multiple times, and they finally called me on the Tuesday after Labor Day, 1995. It's not a bad memory, too burned into my memory that I remember the exact date, that said, hey, just bring her in. We figured it out. Her distemper, she just needs a booster, blah, 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 blah. And she had died on Labor Day, the day before. So as a pet owner, felt horrible that I watched this dog do this. But distemper, like that shot is that a core? Is that a core shot?
Yes, distemper and parvovirus vaccines are both considered core vaccines. Those are two diseases that every dog should be vaccinated for, starting as puppies around 8 to 9 weeks of age, every 3 to 4 weeks until they're at least 16 weeks of age, and then boosted a year later. And it depends on whether they're given a vaccine that is labeled a 1 year or 3 year. We try to give a 3-year labeled vaccine, so they don't have to get the vaccine every year. And those are the two agents that we do vaccine titers for, because if they're at risk and their antibody levels are high enough, then they may not even need the booster because their immune system is already primed to fight that off.
Okay.
If it's low, then we evaluate the pet's health status and their risk to see if we need to give them the booster. And the titers and the vaccine, if they need it, are included in our wellness plans.
So let me ask you this question, like logistically as a business owner, do you see, and you probably don't have percentages, but roughly, if you see 100 patients in your clinic, is there a percentage, like has it shifted to where people are doing that care plan? Like, are you seeing more people shift to that, or are people just mostly still come, pay as you go, I'll suck it up and deal with it?
Yeah, I think I am seeing more people doing the preventative care plan just because they know prices are going up, because when you sign up for the plan, your fees for those services are locked in for a full year.
Okay.
So if you signed up for example, being this is October, if you signed up for a plan today, your payments and everything are going to be the same until October of next year when it renews.
Right.
So you're not going to be paying, February 2020 vaccine prices because you're locked in to the prices with the plan now.
And that lock-in is for 1 year.
It's for 1 year. Yep.
So yeah, I do something very similar with that, with the marketing that I do. So that is in this current climate, that is definitely a selling point for a lot of people. Do you and you had said 2020, you mean like February of 2024?
Yes, I meant 2024.
Yeah.
Yep.
We're locked in on 2020. It's so embedded in our brains. We like that's our default reset year. So let me ask you this. So do you, when you're not in the clinic, do you live, the clinic is in Lutz, correct?
Yep. I live in Land O'Lakes. I don't live that far away from the
You live pretty close. So now do you have at your house, do you have like 6 cats, 3 dogs, and like a bird? Or when you get home, do you just kind of decompress and there's no animals?
Well, I try to decompress, but I do have pets. I don't think any self-respecting veterinarian doesn't have a pet. I've got 3 cats and a dog.
3 cats and a dog. Okay.
Mhm.
And everybody gets along. It's a copacetic environment, or do we have one cat that just hates the dog?
No. Actually, my youngest cat gets along with the dog pretty well. The youngest cat likes to terrorize the 2 older cats. Because he's like 2 and he's just crazy and he just doesn't know when to stop and when to take no for an answer. So he gets put in timeout quite a bit.
It's funny is a woman I was seeing had a cat and a dog. She had a French Bulldog as a puppy. He was integrated very quickly with Norman. So they got along pretty good, but he's a puppy, so he wants to like bite his face and bump into him. And Norman is 7. He's just kind of like, whatever. But then she has a cat, and the cat, like, we thought the cat would be okay with Norman. Norman is so easy. Like, he's literally been sleeping this entire time while we're recording. The cat was so scared of Norman, like hid for the hills every time Norman was around. So it's just funny how, I think a lot of it has to do like all of us, right? Like our past experience, maybe the interaction, it's something different. It doesn't feel right. But the French Bulldog and the cat, they would like lock up and they would wrestle and fight and do all sorts of stuff. I mean, it was like chaos when the 2 of them got together. And Norman would just kind of be like, oh, whatever. I kind of dealing with it. So as we start to kind of wind this up, a couple questions. Like, I always ask people this because I think it's important for other business owners to hear about this type of stuff. But has there been a time, and a lot of people, it's COVID, and it might be for you too, but where you ran into a challenge or some sort of setback that you had to overcome, where you were maybe like, man, I don't know how we're going to get through this. And what did you do to kind of switch it up to get to where you are today?
Well, COVID was a challenge, but I would say the biggest challenge was just getting the practice up and off the ground. I did relief work for 10 years. So I bounced around to a bunch of different hospitals. There was some life family changes where I need to be in one place where the family could find me where needed. Okay. And just starting is such a daunting task to, we had to, I'm leasing where I'm at now. We are looking for property to build a practice where I can offer more services, but, doing a build out and trying to get people in to pay the bills and things like that. And just getting your information out there and developing the clientele is very challenging and very stressful.
So when did you get started?
We opened up in late August of 2010. 2010.
So, okay. So that's kind of coming out of another time in this country where everybody was kind of up in the air too. So, and then I would think that kind of floating around at a bunch of different practices gave you a real good perspective on, hey, I want to take a little bit of this and a little bit of this and some of the processes of that and how we do certain things. Is East West Animal Hospital kind of a compilation of all these places that you worked at and a little sprinkling of this and that and then you on top of it? Is that kind of the deal?
So, somewhat. And of course, the only thing that's constant, I think, when it comes to any business, and especially I think in the veterinary field, is change. We've had to make a lot of changes over the years, not just, we've made some changes with COVID, that I feel have been better for our pets. We do offer the concierge curbside service if people want it, but we still have our doors locked and we have people call when they come in. And initially it was to do the gradual opening, trying to prevent, spread of potential COVID. But we found out that it decreased the stress of our patients.
Yeah, I was going to say.
So that's why we still do it. We do it for our patients. We don't do it for ourselves. It's not because we're scared of getting sick or anything. We do it because when the patients are in the room and there's nobody in the lobby, they're not worried about what's going on in the lobby. And the pets in the lobby aren't worried about what's going in the rooms. And it has decreased the stress tremendously for our pets, especially for my feline patients.
Well, I would think so. I know I've been in those waiting rooms where there's one dog at one end that's just, like Norman is usually the guy who's just sitting there staring at everybody like, ugh. And then there's a dog at the other end who's barking and pulling and all that. And then there's a cat in a carrier that is like back up, freaked out. So yeah, I definitely can see some of that. So it's almost like creating a solo waiting room lobby for somebody, and then you bring them to the back and bring the next person in and kind of cycle.
Yeah, well, we have 3 exam rooms, so we kind of try to rotate them out. Occasionally, if we're backed up a little bit, people do sometimes wait in their car. Generally, people don't mind, especially clients that have been here for a while, because they know this is how we do things. And it's been such a benefit for the pets. We noticed the decrease in stress the first week that we started doing the concierge service of bringing patients into the room, and so we decided to keep it.
So here's my one big question, because you talked about, it's not my one big question, but this is a big question. So you talked about the holistic side of it, the Western medicine side of it, the integration of all that. One of these things that I see on social media, and I want to get your professional opinion on it. So I'm already prefacing it by saying it's social media, so you're probably like, oh crap, what is this gonna
There's a lot
be?
of things on social media.
Right, could be anything. Okay, so I'm gonna bury the lead here. I see these chiropractors for dogs.
Mm-hmm.
Is that something like I look at Norman, and he's a little overweight. Okay, he should be, the standard is about 50. He was about 60 until he got neutered. He gained some weight. He's in the upper 60s right now. But I look at him, and he kind of waddles around, and I think to myself, well, maybe he's got some stuff out of whack. Maybe a doggy chiropractor would help loosen him up. Have you ever seen that? Have you ever actually witnessed it? Is there any benefit to it? Is it just Facebook, social media shenanigans?
I actually have someone that I refer to for chiropractics. It is someone who is actually trained on the human side, but then became trained on the animal side to do chiropractics. My issue with chiropractics in general is, it needs to be done appropriately. And if the person is not a veterinarian that has been trained to do it, if it's a human chiropractor, they need to be trained properly to do the animals, because we're dealing with different species. We're dealing with
anatomy.
Different anatomy as far as that goes. I do have clients that are like, oh, I'll just take them to my chiropractor, but I don't necessarily know what training that particular chiropractor has had. So there is
canine anatomy.
Yeah, there is the I think it's called the American Veterinary Chiropractic Association, where you can look up and see if someone is certified to be a veterinary chiropractor.
I watch the videos, and the dog, obviously these people have gentle care. Because you talk about the fear-free, they're like cradling and caressing these animals, finding these spots that are out, and then you hear them adjust, and the dog's head always kind of just turns and looks like all of a sudden some neural pathway was just opened up. It's incredible. And I think to myself, I would love to do that for Norman, but I'm so scared, and I shouldn't be. I've seen a chiropractor for 20 years. For me, I get relief.
Well, the thing is, because you're dealing with an English Bulldog, they're also prone to different congenital problems with the joints. So you want to make sure it's someone that has dealt with English Bulldogs and also have x-rays done prior. Any good human chiropractor is going to do x-rays prior. And if they suspect, you have a herniated disc or something, they're not going to adjust you until that is checked out. Because if done improperly, you can end up being paralyzed.
Well,
and that's the same thing with them too.
That's my
if
fear.
If you're not a veterinarian doing chiropractic, they do need to, say it's a human chiropractor, by state law, they need to be somewhat supervised by a veterinarian. And the person I refer to, I trust implicitly because I'm familiar with her training.
Well, the other hard part is having an English Bulldog is the anesthesia. It's anesthetizing them. So for me, Norman, if I can maximize his time efficiently when he's out, I try to do that. So last year, I went to get him finally neutered. And when he was under, I had his soft palate shaved down, his nasal passageway opened up, because I'm like, look, if I am going to take the chance at putting him under anesthesia, because there's always that risk with bulldogs that people with a lab don't necessarily quite understand or get, I want to maximize the time out. So listen, here's the checklist. Head to top to tail. We want to get this, clip this, snip this, do this, and get it all out of the way in one shot. But it's the same thing with x-rays. So I can't just lay his chubby little body on a table. They almost have to sedate him, maybe not full on knocking him out, but sedate him enough where he's just going to lay there.
And we sedate a lot of our patients for x-rays, especially if we're doing orthopedic x-rays, because of the position we have to have them in and the stretching of the limbs. Even if they don't have joint issues, it's not comfortable for them.
Right.
But then also when we do the sedation, we take the health of the pet into consideration as far as what anesthetics are used, or if we sedate them at all, or how deep a sedation or anesthesia we do for them.
Well, that's another great point you kind of bring up. That's something that has come a long way, I'm sure, since you started practicing veterinary medicine, is sedation has changed. Like,
yes, sedation has changed quite a bit.
It used to be like you had to like knock them out, and now there's different levels of it where, like, I even see with dental cleanings on dogs where they have a sedation where like they can come out of it. They could kind of bring them out of it relatively easy, right?
Yeah, there's a bunch of different ones that can be used.
Yeah.
And it also depends on the metabolism of the individual patient and their stress level as well.
Yeah,
so
I wouldn't say Norman
can be reversed.
He doesn't have a stress level per se, other than his allergies, and he's on Apoquel. We've done Cytopoint injections. We've done all that stuff. So there's some of that, but he has a stress-free life. I mean, he has a whole futon that he took over. Was supposed to be a bed for people staying here. He's literally taken it over and made it his own. So he doesn't have a lot of stress there. But he does have, you know, a lot of those, like the respiratory stuff, and he does have some other stuff going on. So we try to keep him as chill as we possibly can. Let me ask you, like, the last thing before we wrap this up is, what is the one thing? I mean, I could think of about 5 things that if I'm thinking about East West Animal Hospital, but what would be the one thing you want to convey to people listening to this? There's a ton of veterinarians out there. Some are corporate owned. Some are, you know, for lack of a better term, mom and pop family businesses. What do they need to know about you and your practice that they should be driving to Lutz to come see you?
Well, some people want just holistic medicine or just Western medicine. I think you kind of got to use whatever works. So I feel like I have a bigger toolbox, so to speak, to deal with patients with different things. And a lot of things in medicine is not black and white. Occasionally it is. Sometimes there's certain conditions you come up with that are, but you know, there's a variety of ways to address things. And whenever I can, I like to kind of blend it together. I know some people want just holistic medicine with skin issues and stuff, but sometimes we gotta deal with other things first. Let's get the infection under control. Let's see what we can do topically. Let's see what we can do here. And then let's see about doing some of the other holistic things if we can to kind of maintain things.
Yeah, and I think a big thing with animals, and again, like I'm just a pet owner for 20 years of a specific breed. I mean, you see it across the board, but I think, and you can correct me if I'm wrong, I think diet plays a huge factor with our animals. Like when I had 4 bulldogs, I couldn't do a raw diet because it would just cost prohibitive. Like, you don't think veterinarian care is free. Like, just feeding 4 fat little bulldogs, it gets expensive. Now with him, I'm kind of using up his food, and I do very limited ingredient food. I do weight food. I do all that stuff. But I think diet plays such a huge role in a lot of the stuff that happens to our animals. Like, there's certain proteins that are hot proteins versus cold proteins, right? All that stuff plays it. And if people are listening to this, I'm kind of going down a rabbit hole, but like a hot protein would be like a chicken, right? Like a sort of a,
and
cool
that's actually using Chinese medicine theory of energetics in dealing with stuff.
See,
in dealing with imbalances.
See, so I do, like, if I have a health insurance agent on a podcast, I can't talk for more than 20 minutes. When it comes to animals, I can talk for a longer period of time because it truly, there's so many, to me, pets are put in our lives like to supplement or to just be there for us when we're going through all the things that we're going through, and to not take care of them with proper nutrition, with proper veterinarian care, with proper TLC and love and toys and putting an environment for them. That's why pets are here for us. If we need to come to you, give your website, your phone number, smoke signals, Raven, how do we find you?
Our phone number is 813-948-6534. You can also look us up online at eastwestanimalhospital.com.
Guys, if you're listening to this and you have a pet that you love and you realize that veterinarian care actually costs money, you can't trade a couple of chickens for a vaccination on your dog, and you want to try out a well-rounded veterinary practice in Lutz, in the Land O'Lakes area, Pasco County, definitely go to East West Animal Hospital. You can call 813-948-6534. Dr. Linda Register, thank you so much for being a good neighbor. Thank you for being on the Good Neighbor podcast.
Thank you.
Thanks for listening to the Good Neighbor Podcast Pasco. To nominate your favorite local businesses to be featured on the show, go to gnppasco.com. That's gnppasco.com, or call 813-922-3610.